upstairs in the rooms, I've got countless, I don't know whether Lindsay and Heather do, they're just countless, infinite number of little tricks for kids, which are great. Keeps them laughing, enjoying. Then they bring their siblings, and then their cousins. So it's fun. Okay, so we're just going to talk, this is going to be a very pragmatic talk. I'm not going to go into any studies. It's not going to be evidence-based like some of the excellent talks you've already heard. It's going to be practically based, and a lot of it's on 25 years of paediatric experience. And so a lot of it's anecdotal, and then I'm following up certain theories I have and find that they're very useful. So it's experiential rather than evidence-based. I call it intuitive-based medicine rather than evidence-based medicine. IBM rather than EBM. I don't think there's anything wrong with EBM. I think it's very, very important and crucial. But I don't think we'll learn everything about the human condition or children and their illnesses without using intuition as well, because there's only so much we can do with evidence-based. So we need to be intuitive, we need to get a feel for children in clinical situations and make decisions based on intuition, instinct, follow your heart. And a lot of my decisions are based on that. I come across so many situations in which there is no evidence. If you look up the Cochrane Review, there's not enough data. Further studies are required in this particular area. So, you just got to take some deep breaths and feel what, you access what you know, what you've read, what you've listened to, plus your instincts, plus just follow your heart and hope that you're doing the right thing. So I do a lot of that. So this talk is more about intuitive and practical and pragmatic stuff that I've found to work in my practice. Now, what's this got to do with the talk on second babies? You'll never guess. An iPhone and another phone. And the iPhone is, the mobile phones have revolutionised everything. Everyone's looking at it. What are they doing when they do this? They're building up their thumb muscles. What are they doing? Texting. What's another word for texting? This whole talk, if you can just take away SMS your baby, you've got it in a nutshell. That's my acronym. SMS your baby. There it is there. And if you can just tell parents to remember to SMS your baby and then go back to that. S stands for, security plus other things. I'll go through it. It's swaddling mainly. S is basically for swaddling. Movement is for movement. Sounds is for loud sounds. Babies like loud sounds. Now, all these strategies, I believe, are based on what we believe a baby experiences, a fetus experiences in the womb, which is about the safest place a baby can be. So we're trying to mimic the third trimester through the first 3 or 4 months, which we can consider as the fourth trimester. So SMS your baby is basically an extension of the third trimester. And we use those tools that remind babies of how they felt in the womb. And that settles them. The first one's swaddling. The second one's movement. The third one's sound. And we all sort of know that. But it's nice for maternal child health nurses here and dietitians and other health professions to be able to have that acronym. And it's something good for a parent who's frustrated, depressed, exhausted, sleep deprived, to just have that acronym in the mind and just being able to go through S, M, S. I'm going to swaddle, I'm going to keep the baby on the move, pram ride or stroller ride, and then use sounds. Loud, fairly confronting, continuous, gapless, low-pitched. Why do I say continuous, gapless, low-pitched? That's what we've discovered to be the most helpful sounds to settle a baby, a crying baby. Yeah, the heartbeat is there and it's all the time and it doesn't stop. And low-pitched, why would it be low-pitched? Why? That's right. I don't know whether you remember the physics, but if sound travels through amniotic or any fluid, it drops its frequency, drops its pitch, it drops its hertz. So all our sounds, we've developed this program, you probably know about it, and there's a bit of information out there in the dining room, and it might be out the front here later. And we've developed a program that basically attempts to mimic those three parameters. That is, continuous sounds, and babies are comfortable with continuity. There's always sound. There's the maternal heart, there's the placenta, there's the maternal voice, there's other voices, there's car noises, there's vacuum cleaners and dishwashers and everything. There's never a gap. Babies abhor gaps. They don't like stops. They don't like lullabies as much. Why not? Because there are gaps. Even Beethoven, they won't like as much. And this is all experiential. I've been mucking around this for 25 years. And you know, Mozart and Beethoven and the classics are great, lullabies are great, but nowhere near as good as continuous sounds. Because as soon as there's a gap, they wake up. So they cry. If you confront them with a loud sound, and it doesn't need to be loud, it needs to be a little bit louder than their voice. And then they become distracted by that sound, engaged, and then soothed. And if they're tired, they'll go to sleep. And so that strategy works in about 9 out of 10 babies, no matter what they're crying about. It's a wonderful tool and a powerful tool for parents to employ when things are really desperate. They're tired, they want to throw the baby out the window. They've got this to hold on to. And it doesn't have to be sounds for silence, which is our program. It can be an untuned radio. It can be the dishwasher, washing machine, a dustbuster. Anything that makes it high. It can be a car ride, which also produces these continuous sounds. Swaddle, very important. So swaddle again gives the baby, we believe, again, the third trimester, the feeling of being squashed. There's this thing called intrauterine packaging, and it's very tight. And there's not much movement, there's not much room for movement in the last few weeks of the pregnancy. And that, in fact, is security for unborn babies. And if they can be done like that again, then a lot of them will settle. Not all, but a lot will settle. And you've seen the Russian babies, the way they're looked after in the nurseries, and they're all tied up like this, wrapped up like babushka dolls, one after the other, sitting up. And they do settle because it's I believe it's because it's familiar, it's secure, they've got nowhere to move their arms and legs, which is really the case in the last trimester. It's very squeezy in there. So this is a baby getting swaddled. We have a few steps for that. We go that away, then this away. We use a very simple way to do it. I think that Karitani in Sydney have a somewhat more complex way, and there are various wraps that are a little bit more complex than this one. This is actually a paediatrician from Ballarat wrapping up her own baby, Hamish. Would we be able to have some of the lights off? That looks a little bit light. It's all right. It's okay. Now that baby just looks very comfortable. There's another example. Actually, this is movement. So movement is cuddle, okay? Cuddle your baby. Cuddling, walking, patting, rocking, all those things. Movement settles babies. Why? Because they're used to movement. They're always moving. They're in a game of tennis, or they're in a car, as unborn babies.